So somebody wanted to know about Hutchinson, and Hutchinson, just like all of the older physicians of the back in the day, often have eponyms attached to multiple things, and Hutchinson is one of those. So the Hutchinson sign is a sign of herpes zoster, from herpes zoster ophthalmicus. And so the sign is, if you have the vesicular eruption on the tip of your nose, the nose, that you're more likely to have it get in your eye. And the reason that that sign applies anatomically is the tip of your nose is also innervating your eye because the V1. But more than that, it's the branch of trigeminal subdivision 1 that is in the nose, nasal, to the eye, ciliary. So the involvement of the nasociliary branch of the trigeminal ophthalmic division means there's a direct connection between your nose and your eye. It goes straight from naso to ciliary ganglion, and that can jump right into your eye and cause uveitis. And so that is the Hutchinson sign. We also have a different sign, but it's a pupil sign, and so we call that the Hutchinson pupil. It's also a sign, however. And in the Hutchinson pupil, if you have a supratentorial lesion causing mass effect and shift, like a brain tumor or a hemorrhage, it can cause brain shift and tentorial herniation. And that uncal herniation can press the third nerve against the notch in the tentorium called the Kernahan notch. So the Hutchinson pupil goes along with the Kernahan notch phenomenon, and it's a false localizing sign. It tells you that you have a pupil involved third, for example, on the right, but the lesion is actually on the left side. It's nowhere near the posterior fossa. It's in your brain because you're herniating. And that's why they don't let us dilate patients in the neurologic or neurosurgical ICU. Because in the NICU, they were looking at the pupil, and they've got pupil check every 2 hours. And the pupil check is designed to look for herniation, increase intracranial pressure, and the Kernahan notch phenomenon, a false localizing sign called the Hutchinson pupil. There's also this other Hutchinson thing, which only indirectly applies to us. That's the Hutchinson teeth. And that's a syphilis sign. And you know to know syphilis because, as Osler said, he who knows syphilis knows medicine. And so you need to know the Hutchinson sign, the Hutchinson pupil, and the Hutchinson teeth of congenital syphilis.